Okay, so for SBAR report, we need to do the S for situation, B for background, A for assessment, and R for recommendations. So I'm going to SBAR with the nurse coming on for the next shift so that I can relieve my rights of taking care of her over to the next nurse. So I'm going to start here with, we have Miss Cassandra Rivera. And she is a 61-year-old female who was admitted with abdominal pain and ruptured appendix. She had surgery that was performed earlier this morning. As far as her background, she has a history of asthma and she's had no current effects from that asthma. Her breathing's good. She's still on O2 at 2 liters and her lung sounds are good. She's not on any chronic medications. Okay? So we've done situation and background. The next thing is our assessment. So A is for assessment. Her vital signs today were 130/80. She had a heart rate of 80, respirations of 20. I had the nurse care partner come in and she got a temperature of 98.9. Saturations are 98% and that's on 2 liters. She's maintained that. Her lungs are clear bilaterally. She had a pain level of 4 and her goal is 3 to 4 on the scale. I was able to ambulate her 2 times today without difficulty. She does have a dressing to her right lower quadrant, and I'll just show you that. It does have a little bit of drainage that's noted, and you can see I've marked the line, and she has not bled beyond that line for my shift. Okay. She does have a JP drain as well. Here's the JP drain, serous sanguineous drainage. She did 30 milliliters of drainage for my shift. Her urinary output, she does have a Foley catheter, clear yellow urine. For my shift, she did about 500 milliliters of clear yellow urine. She has not had a bowel movement thus far. She has reported a little bit of passing flatus. She does have positive bowel sounds in her right lower and right upper quads. All right, so we've taken care of situation, background, and assessment. Our last portion is recommendation. This is what I recommend for you to follow up and monitor. So continue to monitor her pain. She does get dilaudid for pain. Her last dilaudid was at 15:30. We need to continue to ambulate. She has done 2 for our shift. And monitor for bowel activity, progression from flatus to bowel movement. And then monitor for a decrease in that JP drainage, okay? And we also need to monitor for lab values. Her last H&H was this morning. It was 10.4 and 32. And her next one is due at 2100 just to monitor her hemoglobin and hematocrit.
Any orders about weaning the O2 off?
Yes, actually we can start weaning O2
Okay.
on post-op day 1. And it can be to room air for a saturation greater than 94%.
Okay.
Okay, any other questions?
I think the surgeon's coming in to change the dressing unless there's an issue.
He'll change it tomorrow.
Okay.
Okay, so this is your SBAR communication, SBAR situation, background, which is your history, assessment, and recommendation. Thank you.